A single act of good can go a long way. It can cross oceans, cure disease, and create equality. As members of Rotary, we are people of action, and our actions have the power to speak loud and clear. Our vision and commitment to finding solutions provides access to high-quality care so vulnerable mothers and children can live longer and grow stronger. Rotary members worldwide work to improve maternal health and reduce child mortality by increasing access to essential medical services and implementing life-saving programs. We're providing comprehensive maternal care, preventative screenings, and family planning that empower women and girls to take charge of their own destinies. Our efforts aren't just changing lives. They're saving lives and strengthening families by training birth attendants, providing prenatal care, newborn immunizations, and facilitating mobile health clinics. Thanks to Rotarians like you, patients are receiving the practical and compassionate treatment they deserve so that babies are born safely into the arms of healthy mothers. Your contribution keeps mothers and babies far and wide connected to a world of good. Every gift is an action that speaks volumes in delivery rooms, communities, and across continents. Learn how you can support the cause that means the most to you.
Thank you for this video. Thank you for your video explaining the collaboration action lowering maternity encountered deaths, abbreviation of CALMED. What is your core message for medical staff dealing with our CALMED program? Is it foreseen as a strategy to bridge gaps in accessing health care for mothers and babies in childbirth emergency? Himanzu, the floor is yours.
Thank you, Urs. Thank you, Albertine, for showing the video. Good morning, good afternoon, and good evening, my fellow Rotarians. It's a great pleasure and privilege for me to introduce to you a group of people who are not visible, and that is a group of Rotarians, experts, and our collaborators who joined us. So our success is their success. And I'd like to start by saying that our program is developed by Rotarians, with Rotarians, and for Rotarians. So for more details, please, if you can, visit our website, which is www.calmedrotary.org for further details. Let me just move on and explain to you a little bit about the background of how this developed. And of course, my friends, this is a reflection of my long association with Rotary. As Urs had explained, I've been a Rotarian for 40 years. And currently, for instance, I'm serving as a medical director of Rotary Action Group on reproductive maternal and child health. I'm also a director of the and founder chairman of Rotarian Doctors Fellowship. And last but not important, not least important, cadre European Zone Coordinator in Maternal Child Health. Also in professional, and I say all this just to explain how it evolved slowly over the years. I'm an obstetrician gynecologist, very involved with medical education, practice and research for over 50 years. So now you asked me about the core message. Well, our message is not just for medical staff. It is for everybody who comes in contact with a woman or a child who is in an emergency, such as bleeding or not breathing or collapsed. I like to suggest, my friends, that this woman or this child is on fire. Of course, you call the fire brigade, but you must do something, what you can, to stop the fire, to douse the fire. Because, my friends, it's the first hour, the golden hour concept that's very, very, very important. Because with every hour, more than 1 hour that passes, the survival of the child or the mother goes down by between 30 and 50%. So timing is very important. So what we have done is to create a framework of action where the help is received in time and in the correct order or in the best possible way. So what I'm trying to say to you is CALMED is not just one program. It's a large program inside of which there are 3 recognizable closely related programs. What are these? Well, firstly, we are raising awareness of health problems, the emergency nature, the behavior, the nutrition, everything in our community using pictorial film charts, or of course, if you want to be updated, using videos and telephones and so on. The second one is very important. We want to bridge the gap of the woman or a child in emergency from home to hospital. So you have to get a good ambulance service, even the low-cost ambulance. We've got to have a paramedic training, primary healthcare training, and now to enable these people to give the best possible care. Because remember, delay is dangerous, delay kills. And thirdly, very importantly, and you saw that in the video, the upskilling of health professionals, doctors, nurses, to give them practical training of skills, knowledge, and of course behavior. So the final thing on this is that this is a complex task we cannot do on our own. We have got a group, but we need partnership locally, nationally, and globally. Thank you.
Thank you, Himanshu. You started 2 projects in India and the third is in progress. What was the output and what the outcome of your project?
Thank you, Urs. This is very important. We do not have time, of course, to go into the length. What we did was to do what is called a logical framework analysis So what happened to our work, then subsequently what they resulted, and ultimately to think. These are partly in our website, as I said, but it's enough to summarize here by saying that our completed global grants are 2 over a 5-year period between 2013 and 18. And the foundation money was $1,000, but we have made a calculation of how much it would have cost to get all these volunteers and Rotarians who give that free of charge, and that adds another $143,000. This is called replacement cost value, and I think it's very important. But coming to the program, we went to 2 tribal areas in India, Northeast and Northwest India. We have 4 pre-visits, because we heard earlier on in the 2 presentations how important it is to go and visit them to find out what it is they need. And my friends, it is their program we create. And so we have 6 vocational training team visits. This is followed by 4. Our core volunteers are 11 healthcare professionals from the UK, and we trained in the first phase 39 master trainers. And they are the heroes. They are local. They then trained under our supervision initially and subsequently an estimated 240 basic doctors and nurses who are upskilled. Now, I mentioned to you the village mobilization. So we trained, sorry, not we, they trained 320 village health workers. In India, they're called ASHAs. ASHA means hope, but they stand for Accredited Social Health Activists. And they are spread over 800 community groups. They empowered. So my friends, you can see the cascading effect, and this is the important one. And finally, I know what you've been waiting to hear. We've done a modeled estimate, and we saved approximately 250 mothers and 1,250 babies' lives. And of course, we saved damage to many more mothers and so on. So that was now. Oh, and I forgot to tell you, modesty prevented us from bragging that we got 2 awards, Champion of Change Award and the London Times Sternberg Award for this work. But before I finish, I just want to mention 2 more things that to bring you up to date with where we are. One, we have a current global grant in Meghalaya, which is another tribal area where training has be currently taking place through distance learning. And as you heard our chairman of trustees saying that we use the current disadvantage to our benefit, and I think we're doing that. So we're using mentoring and digital technology and the network. But there is some more good news. The program story doesn't finish there. We produce legacies for use by any Rotarians anywhere in the world. So just to explain that, we finished our 2 global grants, but we have got legacies which can be given free of charge to any Rotarians anywhere in the world. And what are these? There are basically 3 things, and it is all growing as well, of course. One is the toolkit of training materials. This is videos, simulators, and the know-how. Secondly, a group of empowered, trained professionals ready to assist. These are our 11, but now grown up to 13 professionals who are ready to help. And thirdly, very importantly, where man joins technology, we have digital technology and humanitarian support. We are creating apps, modifying an existing apps. We are using telemedicine, and of course, as I mentioned to you, a mentoring network. So my friends, these are all available free of charge for Rotarians to use as legacies of our program. And we're very proud of this. And I just want to make the point that our program is a living program. It is not fixed. We're developing, we are growing, and that's the way to go forward. Because there is no vaccine against maternal mortality and child mortality. This has to be adjusted to and adapted to the local needs, priorities, and abilities. Thank you.
Thank you, Himanshu. Following your last remarks, I ask you the next questions. Please answer quite shortly because we are already over time. My question is, together we started with the first template of actions and with the core contents of CALMED in Uganda, and for the first time in collaboration with WHO, but also with different cultures and religions. What was your first impression of externalizing your project over to other continent? Please,
Thank you. Thank you. That's a good question. Sorry, we're running out of time. It's a complicated issue, but you can always visit our website. You see, we are not new to going to another culture. India is a big country. The gap, just to give you an idea, the gap between the three project sites is minimum 1,000 kilometers, maximum 3,000 kilometers. So there's a huge cultural differences, and we're used to it. But everywhere we go, we have to make friends, like you have heard in the other two projects, and we have to overcome their challenges. So we met friends, we work with them, and we point out, we create a program which is adaptable, locally suitable. So our message to you is that we want to make not only a bigger, bolder, and better program, but we want to make a program that suits you. So you are in the driving seat, and we help you all the way. So consider we are your satellite navigation. You choose where you want to go, and we help you. So coming specifically to your points, Woods, there are 6 stages, all interlinked, as in a moving carousel. So my fellow Rotarians from Uganda or anywhere else you want to join, you join in the carousel. So what do? First of all, we inquire. What are the problems? Secondly, we engage people locally and internationally. Third, we join with you. You empower with our logical framework analysis. We tell you how it is done. Then you help educate your community by training or whatever is needed, and then you implement. Then comes you and I and us evaluate. Are we doing right? Do we need adjustment? Then you, on the assumption that you're on the right track, you energize. Your humanity joins digital technology. I mentioned to you all of these. And so please jump in the moving carousel wherever you wish and move forward. So my friends, it's a living program, and together we create a living program, bespoke program, response program tailored to the needs and priorities of your community. Thank you.
Thank you. Now I jump over to Margaret Tuwere from Uganda. Before she answers the same question, I will shortly introduce Margaret Tuwere. She holds a Bachelor of Arts degree in Community-Based Development, a Diploma of Business Management and Administration. Actually, she is the Executive Director of EVET, a national non-governmental organization. Margaret Tuwere has a leading position in programs and projects leading to greater community development, driven by the interest and professionalism. Actually, Margaret is the overall manager of the GOLD project that is spearheading elimination of child labor and empowerment of women and youth to self-reliance. I met Margaret for the first time during the breakout session at the Rotary convention in Hamburg, where Himanso was present as well. Please, Margaret, you have the floor.
Thank you very much, and good afternoon to everyone. First of all, I would like to thank Dr. Himanso for the presentation, which we are planning to replicate in our country, in Uganda. I find his work interesting, and CALMED a very good model for people to replicate. Having made great efforts and made big strides in saving mothers and babies in India, I find him very passionate about saving the lives of mothers and children, and therefore making a personal effort to see that the methods used in the implementation of the project yield tangible results and becomes a model project. So in Uganda, we are planning to replicate the project, And I'm happy to be with you this evening, and then can answer your question.
Thank you, Margaret. It's a pleasure to have you here from Uganda. You will probably say only one being African in this institute. After the first steps done in your country, where are we with our plans? Please, Margaret, its floor is again yours.
Thank you very much. We are planning to implement the CALMED model project, and the stage that we are on, we have the application has been completed, approvals obtained, and the memorandums of understanding have been signed and submitted to our international partners and Rotary International for consideration. We plan to use the CALMED model in our action to end preventable maternal and newborn mortality in Uganda, starting with the 3 districts of Wakiso, Kabarole, and Kavali. And we are using this method in collaboration with the Rotary International, Health Major Gift Initiative, Rotary Clubs of Entebbe, Kabarole, and Kavali, and to include the Rotary Clubs along the Entebbe corridor. And we are using the WHO priority initiatives towards this goal of ending the preventive maternal mortality. We are going to have the program running using the objectives. We would like to create awareness in the communities. We create to give more knowledge to the people, to the women who have to access these services, because we have to link up with the cultures where we have like traditional birth attendants involved, and the traditional birth attendants, some of them who have some knowledge they use locally to help the women. So we want to encourage them to make sure that.
Explain in an only few words, how do you see the future of CALMED in Africa? Please, Himansu.
Well, thank you very much. I will try and be in a few words. I think what Margaret mentioned was training the traditional birth attendants. I see that as a challenge, because if you remember, World Health Organization did this in the early part of the millennium, something like 2006, and they cannot be trained. That was their conclusion. But I have an open mind. But I'd like to just highlight to you something just as important. Margaret will like this. The data I have about Uganda is that the maternal mortality ratio, this is 2017, it's already 3-year-old, is 375. And I live in UK, this is 375 women dying at childbirth per 100,000 women delivering. We have in UK 4 out of 100,000. I can mention it another way. Imagine that if you have a group of 15-year-olds in a room, and this is known as lifetime risk. Both data are published by World Health Organization, World Bank, etc. Guess what? In England, we need 8,400 women. In Switzerland, we need 10,000 15-year-olds to say that one of them would die in her lifetime at childbirth. So the higher the number, the safer childbirth is. And now ask me, what is the risk in Uganda? Well, at least in 2017, you need only 49 15-year-olds. One of them will die. So we have a challenge. And I think even more bad news, I'm sorry, that COVID is putting us back. You heard Ravindran mention the financial problem. Health-wise, it's estimated between 9 and 38% of more mortality will be added because of the COVID indirect influence. Anyhow, let me move on. I've said enough. Margaret, we are ready to work with you. We are together. Join with governments and WHO in a quality of care network. You are there just to show you that we are prepared through the existing program. Woods and I both mentioned that we have an e-learning platform and we are already halfway through. So by the time your grant is ready, you will be fully. We are even more adventurous. We are doing an app development in a cell phone. We have actually, this is already in Africa, South Africa and Kenya has e-ranger bike. We have got paramedic training, and we are developing a mentoring and communications network with telemedicine that obviously you have to do. And I invited you to join our website. So I finish up by saying what Ravindran said and everybody said in the video, that we see together a world where people unite and take action to create lasting change across the world, in our communities and in ourselves. So my friends, on behalf of the lives of mothers and babies that you will achieve, may I thank you. Thank you.